Welcome back.
Good golly, are you okay?
All good, Ben.
Jeez, well, funny enough, our next guest is about to talk about coughs. This wasn't staged at all, you guys.
No.
I mean, acting, thank you. So Dr. Tom Haroldson with Entira Family Clinics is here to share some more. So Doc, did we fool you at least?
Was that a pretty dry
It was
cough?
a very convincing cough there for me. Yep.
Would
Yeah.
it have gotten me out of class if
Probably,
I went to the
right?
nurse's office?
So you and I were just talking during the break. My kid had pneumonia, which is not exactly what we're talking about, but he did develop a cough, and that it was like one of those things with the fever and the cough. They're like, okay, we really need to get him in. This is like more than just a cold. So when you talk about coughs, you say there are three kind of different types of coughs we should look out for. What are those?
Well, we kind of classify, or at least I do, at time, right? So coughs, you have your acute cough, typically less than 3 weeks. So that's what most people get. But then there's the subacute cough. That's the cough that just lingers, doesn't really go away. That's your 3 to 8 week time period. And then there's the chronic cough, longer than 8 weeks, okay? Those are the ones where you have to kind of scratch your head about what is going on here. It's not necessarily infectious, or rarely is infectious when it's that long a period of time, and you have to start thinking outside of the box of what's going on here.
Right.
Can it be confusing too, because we're getting into flu season, but you also have allergies going on with the harvest and things getting kicked up in the air. So how can we help distinguish like what I might be experiencing?
Yep. So I mean, that's the hardest part about coughs, is that they have similar qualities. Now there's nuances, and it's about the outside part of the story, the other contributing factors, the fevers, or do you have a scratchy throat, itchy ears, itchy eyes sort of a thing, right? You know, that's probably leaning more towards allergies sort of a thing, because it is the time where it could be anything at this point in time.
Yeah. So on the acute side, when it's just like maybe for a short amount of time, are there differences in just like how it sounds? You know, like, are you thinking like real chesty? Is it kind of in your throat? Is it real barky? I know whooping cough has been going around. That has a very distinct sound to it as well. What should we be listening for?
Yeah, so I mean, just everything you said there, right? Is it kind of rattling in our chest? That doesn't necessarily mean bacterial versus viral, but that is more of an infectious process versus, hey, do you have stuff just draining down the back of your throat and you're getting that irritation back there? That can be allergies versus viral sort of a thing. So the fever, these kind of other components to your story there, right? Now whooping cough, or there are a certain few types of coughs that have a different sound to them. The whooping cough is the same normal. It's this harsh kind of cough, really kind of almost you can gag you and you can vomit thereafter, but it's the inspiration after you kind of cough a whole bunch, it has this whooping noise. So as your kid, right, or an adult, mostly kids, take that breath in, that's where the whoop sound.
And that's the real like warning sign?
Yeah, it's a highly contagious thing. There's treatments for it, and you should seek your doctors, right, out if you're hearing your kids have that for sure.
Oh, so I thought the whooping part of it was actually the cough itself. It's more when they breathe in after their little coughing fit, that sound, that makes that sound. Okay, so the subacute things, that's 3 to 8 weeks. I mean, my goodness. I mean, that's still, I mean, 2 weeks is a long time for a cough. 3 to 8 weeks, what are we looking at there? I mean, what can kind of cause 3 to 8 weeks of a cough?
Well, it's typically getting over that cold, right? So we call it the post-infectious cough because you've really probably fought off the inciting incident, right? The virus is gone, or the bacterial, infection's gone.
But the cough is lingering?
The cough lingers, and it's due to inflammation, right? These bacterium and viruses cause irritation in our upper airways, typically our bronchi, so bronchitis, right? And it's just inflammation. It's really gunky, really junky, usually productive, really nasty kind of sputum that we have there. And it just doesn't go away. You kind of feel fine otherwise. You have most of the time your energy back. You're not feverish anymore, but you're just coughing. Everyone's looking at you like you have the plague.
I know.
Right? And it's the big thing to do there, right, is symptomatic relief. Try to calm down the cough, loosen up that stuff, and try.
And cough drops seem to work, especially when we're talking so much in this type of job. It's good to have in the back pocket.
I say a pocket full of cough drops, right? Goes a long ways. Just kind of helps soothe it, makes you more comfortable during the day when you do have to talk to people.
And when you're around people, like at work, and someone's kind of, even if they're covering their mouth, it still is distracting.
No, exactly. So like,
Get that checked out.
But not all probably cough drops are the same. Like, is it personal personal, whatever your personal choice is, whatever you feel like works for you. I mean, how do you, when you say, oh, just go get an over-the-counter cough drop, what do you sort of recommend?
I do say whatever historically worked best for you versus what do you like, right? Kids will have a little bit more gentler cough drops versus, ones that have more menthol, because it has that cooling effect that kind of helps also open up your airways a little bit there from the congestion standpoint. So there's no one that's better than the other.
What about the Vicks Vapor Rub? I actually when I got sick, I kind of liked it.
Yeah.
I'm like, maybe I should just like sleep like this all the time, because I just like put it right here. Like, this feels good when I go to bed.
So Vicks Vapor Rubs, or those menthol rubs or whatever, right? Not brand specific, fantastic, right?
Yeah.
So that's also best for kids, because cough suppressants for kids really are not recommended. They have a lot of side effects and they really don't help improve things. So those rubs are a really good way to go to help your kiddos get through their illness, let alone yourself.
Yeah. I might just do it when I'm not sick.
Yeah, Ben, we know what you're going to be doing in addition to cutting the pork loins. When it comes to a wet cough, is that something that we should be concerned about if it's like a mucus type cough?
It's more so, is there a fever going on? Are we exhausted, no energy, right? Is it more than just, hey, I have this gunk that I need to cough out? Because if it is just that, I have a cough, it's productive. That's your Mucinex, your mucolytic things, your cough suppressant. Just get it out of your system and give it time. But when you start having a fever, or when you start having, I have no energy, I'm zapped, that might be more of that bacterial infection, that pneumonia that may need an antibiotic.
That your son had. Okay.
Yeah. So this is kind of a gross question, but I'm curious. So when you are coughing stuff up, whether it's brown or green or whatever, it's kind of nasty. It's good. That's good, right? To get that out of there. Is that actually part of the infection that's coming out?
No.
Okay.
No. It is just your body's producing mucus to clear that stuff out, right? So it's not clearing out the virus or the bacteria, it's clearing out the junk and the inflammation and everything.
Okay.
So it's kind of our natural reaction to the infection.
Okay, so follow up to that. Now, what if all of a sudden you're having a coughing fit and you spit up blood?
Yep.
Is that like an immediate go right to the hospital, or like what's the threshold there of saying like this is way worse than just like coughing up some gunky stuff?
I wouldn't say go to the hospital, right? But that is a call your doctor thing, right? So the most common cause of blood in your mucus, your sputum, is that you just kind of tore the back of your throat a little bit from coughing so hard, or a popped blood vessel kind of deeper, and that's really not a big concern. But those are signs of the big bad scary stuff, right? Do you have lung cancer, right? If you have a history of smoking, right? That typically can cause a bloody, cough sort of thing. Or do you have a lung clot? So there are other conditions that are not just infectious. And if there's ever blood, you should just be checked out. Get cleared. And if it is just a viral thing, you just scratch the back of your throat from coughing so hard, then you're fine, right?
Yeah.
Best to get checked out.
Okay.
All right,
Good
we really
stuff.
appreciate it. This is
Thanks,
actually
Dr.
like good
Tom.
information, and you are such a good actor. You even fooled the doc.
Yeah, right. You should hear my fake sneeze. No. If you want to learn more about Entira Family Clinics, call them at 651-788-4444 or visit entirafamilyclinics.com.
We'll be right back, everybody. Don't go away.